most about my job, if you can call it that. But other than the fact that I learn so many new things each time I speak, each time we get someone to come speak, but also I get to meet some fascinating people, and our guest tonight is one of those people. She is extremely smart, she is extremely giving, and she has always been such a great help and friend and resource when we're doing these webinars. So, Moira, again, I just want to say thank you so much for this opportunity, and I know Sherry has a few words to say before you begin.
Okay, I get to introduce her to all of you. Moira Dolan, MD, is a board-certified internal medicine physician, is Executive Director of Medical Accountability Network, which is an educational resource dedicated to establishing integrity in medicine. Dr. Dolan is also serving as a medical consultant for the state of Texas and the Office of the Texas Inspector General. She is the editor of a subscription website, SmartMedInfo, and you can find that at smartmedinfo.com. And this website, it defines that new role that people need to have in their healthcare decisions. Dr. Dolan's presentations are presented in lay language with real-life examples to communicate to everyone. She educates and empowers her listeners with the ability to take that responsible role in obtaining optimal health. Again, her website is smartmedinfo.com. It's there on the screen. And again, I'll echo what David said about feeling so thankful and honored that you're joining us tonight, Moira. Welcome. Are you there?
Thank you very much, David and Sherry, for that introduction and for the opportunity to communicate to so many people as we get on a regular basis with Building Strength webinars. This is a topic, iodine, that is such a broad topic we could fill a whole series of webinars. Like most of the things I talk about, I have lots more to say than I can possibly fit in, but I'm hoping that this will work as an introduction both to medical providers to whom this may be somewhat of a new topic, and also to people who might find themselves in the role of a patient trying to figure out what's up with their own thyroid gland, their own relationship of health and disease to iodine. Having said that, I want to emphasize that nothing that I say here should be taken as medical advice, although it's tempting to do that for a patient who's dealing in an area where their own doctor may not be very well informed on this. What you really need to do is shop around for a doctor in that case. So we'll go ahead and jump into it. Let's see here. As Sherry said, the website is smartmedinfo.com, where we educate consumers on informed consent and provide information on various conditions and medications with information that your doctor may not be telling you or simply does not know. And the unique thing about our website is that we don't have any advertising of any sort, unlike more than 95% of what's available on the web, where people basically have something to sell you on that website or one or two clicks away. So let's jump into iodine. Excuse me, it's an element, an earth and a sea element. It's found in small amounts in the Earth's crust. It's concentrated in seaweed, and it turns out that it's an essential nutrient. Now, how did mankind, who's spread all over the Earth, come to have to rely on a nutrient that you can basically only get in concentrated form from seaweed? And that's understandable when you look at the evolution of the human body. It looks like, if you follow Darwinian theory, that we actually emerged from sea creatures. So we retain the need for iodine that our progenitors, actually were found was something that helped them thrive when they were sea creatures. Now, a lot of what we talk about here is going to have to do with the thyroid gland, and I'm going to go back and forth talking about the thyroid and iodine, although we'll talk about other body systems as well. And that's because the body takes iodine from food and concentrates it in various body parts, especially glands. The number one place that iodine goes is the thyroid, which is this little butterfly-shaped gland in the neck. And it does a lot of things. It controls metabolism, body temperature indirectly. It controls normal cell life. It's It does a lot of different functions. Indirectly controls reproductive ability, indirectly heart rate. So directly it has some effects on metabolism, and indirectly many, many other effects. Now iodine goes to other tissues as well. It's concentrated in the breast tissue and in the ovaries, and it's also concentrated in the prostate gland in men. Now the thyroid gland iodine is also concentrated in thymus, which is a gland that's behind the breastplate. It's concentrated in salivary glands that make saliva in the mouth. It's found in the stomach lining. It's found in the kidneys, joints, arteries, bones. So we're finding, whereas we initially thought that this was just something that had to do with the thyroid, that it's concentrated other places too. The main places, however, are thyroid gland, breast tissue, ovaries, and prostate. Now, when the thyroid gland does not get enough iodine, it enlarges in order to compensate for that. And that's because iodine is used to make up the thyroid hormone. The hormone made by this gland is abbreviated as T4, T for thyroid, 4 for 4 iodine molecules that it needs. So the thyroid gland sends the T4 out into the body tissues. And at the tissue level, it gives up one of its iodine molecules to become so-called T3, which is the thyroid hormone that has 3 iodine molecules. And T3 is the form that mainly acts on the cells. If the thyroid gland is not getting enough iodine, it compensates for that by a message gets sent to the brain, which releases a hormone called thyroid stimulating hormone, which sends a message down to the thyroid gland that says, make more thyroid cells because we're not seeing enough thyroid in the body, not enough iodine. And so it's a compensatory mechanism, but you see these goiters, and this is a picture of a young woman. It's very, very common in young women. You can walk around and take a look at this picture, and in the next week or so, find out how many goiters you can buy. So when we test for thyroid function, we test for how much T4 is flying around swimming around in the bloodstream, and by free T4 we mean the amount that's not bound up to a carrier protein. We also are looking at how much free T3 there is, and the ratio between those two is very important because some people may have enough that the thyroid gland is making enough of its thyroid hormone T4, but it's not converting it appropriately to T3 down at the tissue level. So to get both of these numbers, T4 and T3, is very informative for the doctor. But a thyroid test panel should also include thyroid stimulating hormone. This is the hormone that comes from a gland up in the brain, the pituitary gland, that senses whether or not there's enough thyroid hormone in the bloodstream, and it's the one that comes back down to the thyroid gland and stimulates it to work. Now, a lot of doctors, as a screening test, will only do the TSH, thyroid stimulating hormone, and they're going to miss a lot of cases of thyroid dysfunction if they only rely on that. Additional tests may be necessary. I'll be talking about these in much more detail later on. Some people may have low normal levels of T4 and T3, but they're insufficient in iodine, and there's a specific test that tests whether or not you're sufficient in iodine. The entities bromide and fluoride are related chemically to iodide, and they may be present in too high amounts and may be blocking the conversion of T4 to T3 or the use of T3 by the tissues. So in some people there are additional tests that may need to be done, and we'll get into that a little bit later. Now, the possible functions of iodine go well beyond helping to make up the thyroid hormone molecules. So you've got iodine making up thyroid hormone, which in turn affects everything from metabolism to heart rate to normal cell lifespan to reproductive ability. But then you have iodine itself, which seems to have a direct effect on how healthy the breast ducts are. It seems to have a direct antioxidant effect, which antioxidant effect, that's where the normal metabolism as well as toxins can leave residues of junk, I call it, in the blood. And this is sort of like a pipe that's running water through it, and it builds up rust. And so you want to get that cleaned up by things that are called antioxidants. It also may have an anti-tumor effect. Animal studies suggest that iodine itself, independent of being part of a thyroid hormone molecule, has some anti-tumor activity. We also find that people who are given pretty heavy doses of iodine therapeutically within a day have increased excretion of mercury, lead, and cadmium, metals that are very toxic, that come out through the urine. So it acts as a detoxifier. It also strengthens the immune system and may protect against certain types of pathogenic bacteria, and seems to help people have better blood sugar control. And some people who have iodine deficiency, who are diabetic, can actually come off of their diabetic medication when their iodine is replaced. Now, mind you, no diabetic should run out and buy an iodine supplement and hope that it's going to handle it. This is such a complicated system, the relationship between iodine and thyroid and other hormones, reproductive hormones, as well as insulin, which is, of course, the blood sugar hormone, that it really needs testing and intelligent supplementation, followed again by testing in conjunction with the doctor who knows what they're talking about with iodine. Now, iodine deficiency in pregnancy leads to the birth of mentally retarded babies. In fact, world over, the leading cause of intellectual deficiency in newborns is iodine deficiency. And the areas of our country with low iodine that have lots of people with goiters are the very same areas that have high incidences of mentally retarded babies. There's an area of the country called the Goiter Belt around the Great Lakes. It goes right through Michigan. Very high incidence before iodine started to be put in salt of goiters and mentally retarded babies. Now, a low thyroid condition is what I call the great pretender, thus the mask. So common symptoms of poor thyroid function are so vague and nonspecific and could be caused by any other number of deficiencies or outright diseases that they're very easy to miss, because there's not one thing that says you have a low thyroid. So check out some of these symptoms. Any one of us may have one or two of them. Hair thinning, dry skin, numbness or tingling in the hands, extremely sore muscles, loss of muscle mass. In fact, it's very dangerous for somebody who's got a low thyroid condition to go out and do vigorous exercise, because they can't build that muscle mass with a low thyroid from low iodine. And so they're just damaging their muscles, and it hurts. Constipation, general slowed metabolism, a low body temperature, always having cold hands and feet. Just general weakness, just fatigue, getting tired very easily, having a lack of energy, needing more sleep, retaining water, with the swelling of the ankles, weight gain, and depression. Now, having said weight gain, I want to emphasize that thyroid deficiency from iodine insufficiency is usually only responsible for about a 10-pound gain in weight in terms of fat. Then you have additional weight gain that can happen because of retaining fluid. But the other thing that happens is because of the sore muscles and the loss of muscle mass, the person that has low ability, cannot really sustain exercise. And so that adds more weight. And then because they have easy fatigability, then they tend to be sort of sedentary, and then that adds more weight. So supplementing the thyroid itself probably is only responsible for 10 pounds plus or minus, but all the other things, once you replace the thyroid hormone, the weight comes off way more than just 10 pounds. Thyroid can cause a neuropathy, partly we think because it causes retention of fluid, but it also actually directly affects the nerves, and this can be misdiagnosed as carpal tunnel syndrome. In fact, the person may have all the signs of carpal tunnel syndrome, and unless you replace the thyroid, the surgery is not really going to be expected to be tremendously successful, and you may avoid surgery altogether by finding out what's the metabolic problem that underlies it. The popular diagnosis these days, restless leg syndrome, can actually be nothing more than leg cramps that are caused from low thyroid. And thyroid health also affects brain function. Like I said, mentally retarded babies can be born, which used to be called cretinism. But what also can happen is a person can just become depressed or just not quite mentally alert. On the extreme end of extremely low thyroid, people can go into a profound dementia. So it can affect you anywhere along the spectrum. Hypothyroidism is unfortunately too often mistreated as a mental disorder. And it's not something that's thought of that much in children, and it really should be. But it's much more common to be manifest in adults, and yet in adults as well, it's misdiagnosed, underdiagnosed, and unfortunately treated as depression. Now, if you do not have enough iodine, because of how the iodine element is so essential to making the thyroid hormones, T4 and T3, then you will develop low thyroid. In adults, hypothyroidism is often mistreated as depression, and the person may well have depression, but to throw psychiatric drugs on something that has a metabolic cause without looking for and treating the metabolic cause, I think is just frank malpractice. And all too often, someone does get a thyroid panel. They do get diagnosed as being hypothyroid. But instead of waiting for the metabolic correction with thyroid hormone or iodine or whatever treatment is appropriate for that person, they are all too often put on a psychiatric drug at the same time they're put on the thyroid drug instead of waiting for effective treatment to take place. And we'll talk about some of the hazards of this method of treatment down the road. The very drugs that they give for depression can sometimes aggravate the thyroid problem. So how do you find out if your thyroid function is optimal? At the stage where you are just having a few vague symptoms, your actual blood test for thyroid hormone levels may be in the, quote, normal range. Now, normal, of course, compares you to everybody else who gets the test. Yet if we look at our normal population, that list of symptoms I read out to you are pretty darn common. And we find that when you take a test that's trying to check for function and optimal wellness and compare it against a, quote, normal population, where something like, I read that 1/3 of people born today are going to be diabetic by the time they're 55. And, you know, I mean, our normal population, let's face it, is not the walking picture of health. That is what has driven many functional medicine doctors, and by functional I mean somebody who's treating the person in front of them and not the lab, to look at the wide range of, quote, normal that is reported by labs and thyroid tests. And if a person has classical low thyroid symptoms, yet their test is in the normal range but toward the low end, they'll go ahead and treat that as low thyroid. Whereas more conventionally trained doctors poo-poo the whole idea of that and just say, if you're within the bell-shaped curve of normal, that must not be your problem. And this is a very, very narrow look. Just because thyroid problems are common, making the normal range a little skewed, normal does not necessarily mean healthy. Now, that's why oftentimes thyroid tests are not enough. In many people who have thyroid symptoms but, quote, normal thyroid hormone levels, there's actually a deficiency of iodine going on, but it cannot be seen in some of the conventional thyroid tests. If a person has symptoms but their thyroid tests are normal or low normal, the doctor should, I believe, routinely test for whether or not you have enough iodine. And this involves a simple 24-hour urine collection. So the combination of blood testing for thyroid hormone levels and urine testing for iodine sufficiency will give the doctor a much more complete picture of what's actually happening with your thyroid. When the situation has gone so far to actually cause disease with obviously abnormal thyroid hormone blood tests, then the doctors typically simply treat the low T3 or T4 by giving synthetic thyroid hormone supplement. The usual treatment is to just give more thyroid hormone. This will cause the thyroid hormone blood levels to measure in the normal range again. But what about the pretty common situation of the person gets onto thyroid hormone, the blood tests normalize, but they still have many of the same symptoms? What's happening is the medicine is causing the thyroid hormone to measure as normal. And there's a missing boat here, like, is there enough iodine? Is there conversion happening from T4, which is the synthetic thyroid hormone, over to T3? Are the tissues taking it up appropriately? And in all these cases, this is where the actual iodine sufficiency needs to be measured. As I said, it's a urine test, and if the iodine is found to be deficient by this urine test, then the correct treatment is to take more iodine. Now, that does not mean that people can take iodine instead of thyroid hormone. Depending on the thyroid hormone blood levels, they may need to do both. If it's gone so far to cause disease, most patients will have to be on an iodine supplement and on a thyroid hormone pill. In some people, though, the iodine itself will eventually correct the thyroid deficiency, and then the dose of thyroid hormone can be reduced, and in some people it can be stopped altogether. Now, everybody says, well, what about salt? Don't we have iodine in our salt? Now, the usual table salt that we get is a highly processed commodity, and it has iodine added to it, and it was added to it by a federal mandate when they saw this incidence of cretinism or mentally retarded babies in the goiter belt. And that's when, as a country, the government decided iodine should be added to salt and prevent mental retardation. And it worked. It prevented mental retardation. It prevented a lot of goiters. But it didn't work to the extent of optimal health and optimal thyroid function. And for that, you have to recognize that each person is biochemically individual, and how well they take up the iodine in salt and how much they actually need for optimum health is on a different portion of the spectrum altogether from just preventing an obviously mentally retarded baby. So the amount that's added to salt is very small amounts. That's called fortification. But it's only absorbed with 10% efficiency, meaning that 90% of it does not get taken up by the body. And like I said, this small amount is enough in most people to prevent goiters and much of the severe mental retardation, but it's definitely not enough for optimum health. Now, if we look at other foods that have iodine, there's some fishes, there's some breads, some dairy products, shrimp, eggs, down to cheese, ground beef. We don't have a lot of rich iodine sources in our diet. Now, in the old days, bread used to be made and fortified with iodine, not as a nutritional maneuver, but an iodine substance was used as a dough conditioner. But then there was misplaced concerns about iodine being toxic and the population possibly getting too much iodine. And in response to that, they stopped using iodine as a dough conditioner. So we lost another aspect of iodine in our diet. In fact, in the American diet, we consume 100 times less iodine in our diet per day compared to the Japanese diet. And we consume about 10 times less than we did about 50 years ago in our diet. And a lot of it has to do with the absence of iodine in bread. Because of a recent study showing that iodine could be optimized, it's funny, the pendulum is starting to swing back in the other direction. In Australia, the Australia Ministry of Health just made an announcement that iodine will go back into bread, similar to fortifying salt in this country. So they're being very proactive with this. What unfortunately has happened in our country is that when there was a misplaced worry about iodine toxicity and iodine wasn't used as a dough conditioner anymore, they switched over to bromide as a dough conditioner. Bromide is a toxic substance that has no known nutritional value and is very well recognized to be bad for you. So we now have in virtually all commercially prepared breads, we're getting a source of bromide. Bromide, because it's so similar to iodine, will actually block the action of iodine down at the cell and the tissue level. So not only have we lost the iodine that was in our bread, it's been replaced with a toxic substance that further diminishes our ability to utilize iodine. Are there any questions so far?
I was going to ask, first of all, that's really bad news. But the Japanese, you mentioned, they have 100 times more iodine. Where they get it from? I guess it from.
They get it from seaweed. They use seaweed in what looks like a salt shaker. They use it in as actually not just a condiment, but actually a food. I mean, they'll go ahead and have a little bowl of hijiki, for instance, as a side dish. I mean, they actually eat so much more seaweed. And seaweed is the absolute best source of iodine. And in fact, if you look at the iodine content of different seaweeds, nori, which is the black stuff that surrounds the little rice ball when you get some sushi, is pretty much on the low end. At the very high end is kelp or kombu. Now these are tough, kind of almost rubbery type seaweeds, and the best way people tend to get them is powdered. But a very, very edible seaweeds in between, like I said, that are often served as a side dish are arame and hijiki. And if you go to a Japanese restaurant, you can actually get side dishes of these. You can also get these dried in the health food section of the store or at an Asian market.
Any concerns about toxicity with these?
Well, that's a very good question. It comes up a lot. Is iodine toxic? Iodine is an essential nutrient to the body. Therefore, it's quite impossible to be, quote, allergic to it. And you hear all the time people going, oh, I have an iodine allergy. What happened is they got, most likely, a radioactive iodine dye as part of a dye study that they were getting in a medical setting to look at their kidneys or to look at the arteries around the heart or something. And they had a tremendous reaction to that. That's called organic iodine. Now, not organic in terms of grown without chemicals, but organic meaning connected to a complex carbon-containing molecule. That is not the elemental iodine that comes from seaweeds and that we're advocating and that's in food. So what the person most likely reacted to was all the other stuff that the iodine was connected to, not iodine itself. So there is a huge percent of the population that's going around saying, I'm allergic to iodine. Perhaps they got that because they had a bad reaction to shrimp or mussels or scallops or some other shellfish. Oh, it must be an iodine allergy. No, those animals, shellfish, actually concentrate toxins. They're bottom dwellers. And they concentrate toxins, especially where they're harvested from, which is right along the coastline where all our oil spills end up and where all of our ship channels are in industrial areas. So most likely, again, they got iodine along with God only knows what toxins. And it's, so again, people, really, it's quite impossible to be allergic to iodine. A person cannot live without iodine. So, some people also may have had a skin reaction to the antiseptic povidone iodine, which is the brand name betadine. And the allergy-producing portion of all these things are a complex molecule, not the element iodine. Now, also, there has been many often quoted misinterpretation of a very small study that was done decades ago. Very small study on a few rats where they looked at the effect of iodine on those rats, and it raised concern about the dangers of iodine for humans. We now know that this rat study was terribly misinterpreted, but for decades it was cited as the, quote, reason that iodine was a possible, quote, poison, and thus the pulling it out of bread and everything. These things are not the same as simple elemental iodine from seaweed. Rarely a person will get a rash when they get an iodine supplementation. Some people actually think this is a mild detoxification that's going on at the time. Usually what has to happen is the dose has to be somewhat reduced. Now, we look at what can actually block the effectiveness or use of iodine by the thyroid gland in the tissues. And if you look on the periodic chart of elements, I don't know if anybody remembers their high school chemistry here, and we look over in the second to the last column on the right in green, that is where all of the elements are that we call halogens or halides when they're in their salt form. So you see F for fluoride, Cl for chloride, like the chloride that comes in salt, Br for bromide, I for iodine, and At for astenine. Astenine is actually a radioactive compound. The elements that are in this green column can displace each other. They substitute for each other very easily. So while iodine is good for the body and chloride is needed by the body, fluoride and bromide and adenine are toxic. But there's a lot of bromide in our environment. Excuse me, let me just turn that off. I'm sorry about that. So there's lots of bromide in the environment. Hot tub cleaners. Some people use it instead of iodine in the tub, in the pool or a tub. Pesticides, computers, TVs, all kinds of electronic equipment. In fruit drinks like fruit-flavored Gatorade, for instance, anything that's a fruit flavor, bromide, like it is a dough conditioner, it actually stabilizes the fruit flavor in sodas. So you see it in sports drinks, it's in dyes, it's in mattresses and other types of furniture, it's a fire retardant, it's in all kinds of fabrics as fabric softeners or fabric conditioners, it's in hair products, it's in car interiors, it's in some cosmetics. It's very, very prevalent in the environment. And so we are constantly being exposed to bromide, and it's displacing the iodine in our bodies. Bromide is a hormone interrupter. It promotes the enlargement of the thyroid gland called goiter. It blocks the uptake of iodine and the use of iodine. It interferes with sex hormones. It can delay puberty, decrease the sperm count, and it can cause birth defects. And it can also act as a neurotoxin. It can change brain function. It can alter mood and thought. It can diminish the ability to remember and therefore learn. It can cause some behavioral changes. It can cause hearing problems, and it can cause you to be sleepy. Now, the other element that we saw in that chart was fluoride, and many drugs are fluoride salts. For instance, Prozac. All kinds of drugs actually can be fluoride salts.
Doc?
Yeah.
Those actions, I hate to bring you back, but those actions of bromide,
Yes.
Are they as a result of its blocking iodide absorption and the use, or those are its direct effects?
It's a combination of both. Sometimes we can't tell because bromide as a toxin hardly comes by itself. We just, so some of these are empiric studies, some, just observation, and some are actually applying bromide to a tissue and seeing what it does. So there's an overlap there.
Got it. Okay.
So fluoride is a toxic element that interferes with iodine and the thyroid at several key points. Fluoride inhibits the brain hormone that stimulates the thyroid into making hormones in the first place, and that's the TSH, thyroid stimulating hormone. So fluoride will inhibit that. Another problem with people just getting their thyroids checked on a screen of just getting TSH, thyroid stimulating hormone, measured. It may not measure high, and it may be because you're toxic in fluoride. Fluoride also takes the place of iodine in the thyroid gland itself, and it blocks thyroid stimulating hormone from acting on the thyroid gland. And this we often see in someone who has a high thyroid stimulating hormone, but they're low thyroid, and you give them synthetic hormone, and their TSH remains high. It could be that fluoride is sitting there blocking its action. Fluoride interferes with the enzyme that attaches iodine to protein in order to make the thyroid hormone. And finally, fluoride switches off the machinery of body cells so that they can't take up the thyroid hormone from the circulation. So we see fluoride interrupting this at the level of the pituitary gland in the brain. We see it interrupting it in two ways in the thyroid gland itself, and we see it interrupting with the use of the tissues of thyroid hormone. All these things can explain why it could be that someone gets thyroid hormone testing and it doesn't exactly reflect what's going on with them. It could be an iodine insufficiency that's caused by being displaced by fluoride. One of the most prevalent sources of fluoride is the vehicle, in other words, the thing that makes it into an aerosol in these inhalers. So people have breathing problems, asthma, reactive airway disease, emphysema, and they're using inhalers, and they're actually delivering fluoride directly into their lungs. Pesticides are a source of both fluoride and bromide. Industrial toxins are a huge source of all kinds of halides. In fact, astatine, which I showed you was in that same green column, is a degradation product of uranium and thorium. And so especially when we're using these, radioactive substances for increasing purposes aside from just, energy and weapons, we're starting to see more toxic halides in the environment. Now, radiation exposure, such as after a nuclear reactor accident that happened in Chernobyl, you may have remembered at that time that, northern Russia and northern Europe, there was just a big run on the pharmacies to go get their iodine supplements. And that's because after a nuclear reactor accident, the thyroid gland is very, very susceptible, more susceptible than other organs to radiation damage. And when the thyroid gland, however, has enough iodine before radiation exposure, it doesn't concentrate the radioactive iodine that it consumes afterwards. So let me give you an idea of that. There's a radioactive exposure, and so radioactive iodine is released. That radioactive iodine falls and fall out onto the grass. The cows eat that grass. The cows start producing milk that has radioactive iodine in it. So the person drinks the radioactive milk. That radioactive iodine in the milk then goes to the thyroid gland, because remember, the thyroid concentrates iodine. And it starts damaging the thyroid gland. But if someone is sufficient in iodine before they get the radioactive iodine exposure, they won't take up that radioactive iodine because they have enough iodine, you see? So that's when Chernobyl happened. People went out to the store and got iodine or got iodine tablets from their doctors to load up on non-radioactive iodine before the fallout hit them, or they were eating the radioactive food downstream months later,
How did they know to do this? Was there like an announcement?
Oh, it's actually even in our own country's civil defense plans. They have them all fallout shelters and all that are stocked with iodine. I mean, it's just a well-recognized thing. The public health departments of the countries, Sweden, Finland, Norway, Denmark, they all put out advisories to go get iodine. Now, a recent study showed that just living within 90 miles of a nuclear reactor is associated with higher rates of thyroid cancer. So even low dose that may be episodic or continuous can actually expose us to radioactive iodine. It's so avidly taken up by the thyroid gland. It's like a canary in the coal mine. If there's going to be radiation damage, it's going to hit the thyroid gland first. So the people who are iodine deficient would be most likely to be affected. So you may ask, what can you do to protect yourself and your family from radioactive iodine? Now, the thyroid cannot tell the difference between radioactive and non-radioactive iodine. It'll take up iodine that's radioactive in whatever proportion it's in the environment. So if the milk they drink, if 50% of the iodine is radioactive, then 50% of what the thyroid gland takes up will be radioactive. Now, if large amounts of radioactive iodine are released during a nuclear accident, then the government usually distributes large doses of stable iodine as opposed to radioactive. Non-radioactive is also called stable. So if you raise the concentration of stable iodine in the blood, it'll increase the likelihood the thyroid will absorb it instead of radioactive iodine, just because it's there in greater proportion, you see. So researchers have actually compared people, a group of 574 thyroid cancer patients who hadn't been previously exposed to radiation, compared to patients that had thyroid cancer that were exposed to radiation, okay? And they found that the people who got the radiation-related cancers had to have more aggressive surgery, usually had to require additional surgery, usually had more advanced disease, were more likely to have distant metastasis, more likely to still have thyroid cancer when they were followed up or have recurrent cancer, and were more likely to die of the disease. So there obviously are other things that cause thyroid cancer, but if you get your thyroid cancer from radiation, you have more aggressive disease and worse clinical outcomes than patients with thyroid cancer from other reasons. That was a study that was actually published just this year in the April issue of Head and Neck Surgery.
Did they explain why?
Well, you know, radiation as a cancer-causing agent is generally more damaging than other things. It acts quicker and it acts more ferociously. Now, you know, there's also radiation coming from cell phones, and I actually started to put a table up here listing the different cell phone brands and what their radiation was, but it's funny, the government does not tell us exactly what the radiation is. It tells us what the acceptable level of cell phone radiation score is. In other words, they've kind of done some little math with it and come up with these little scores instead of actual radiation dose. And I would really have to leave it to somebody with your qualifications to tell us what does that mean in terms of actual rads, you know, and we always compare to a chest x-ray, for instance. But there's different numbers. You can go to your own cell phone manufacturer's website or to government websites that list cell phone radiation rates according to this SAR score. However, they're all in the same range, let me tell you. Now, and then some devices are not listed on there because they're not listed as telephones and therefore do not have to have the rating. It may surprise some people who have Blackberries, for instance. You don't generally find Blackberries on there because Blackberries are considered personal assisted, whatever they call it, a PAD, you know, and they're not, PDA, they're not considered cell phones, so they kind of get around it. But the advice is to use a remote, you know, earplug instead of having it up against your ear, and to not keep it in your pockets where it's near your reproductive organs or in a shirt pocket where it's right near your thyroid gland, or least of all near your head to talk on it.
So I guess we should all walk around with handbags then.
Well, at least with earphones, you know. So we'll talk a little bit more about cancer, and again, I'm going back and forth between iodine and thyroid and iodine itself. As I said, iodine is highly concentrated in several areas: thyroid, breast, ovaries, and prostate. And poor thyroid function is the main effect of low iodine, but its iodine deficiency seems to result in a higher incidence of cancers of not only the thyroid, but the breast, ovaries, and prostate gland. And it's not uncommon to find iodine deficiency and thyroid disorder in the same women who get breast cancer. So there's a 3 times higher incidence of breast cancer in women who have goiters from iodine deficiency. Breast cancer tissue has much less iodine in it compared to surrounding healthy breast tissue. So there's something that's gone awry with this breast tissue, that it's not getting iodine the way it should. Iodine causes cancer cells to undergo accelerated programmed cell death. So every cell has within it genetically programmed how and when it's going to die. And iodine promotes this normal cell death, so that abnormal cells who are likely to turn into cancer don't tend to hang around. Now, there's several different forms of iodine. Inorganic forms, and like I said, not connected to a big complex radioactive molecule or some big complex carbon-containing toxin. The inorganic forms are safe and beneficial. The organic forms can be highly toxic. Iodine is converted to the salt iodide in the gut. The breast tissue takes up the regular, just elemental iodine much more avidly, better than iodide salts. So if somebody is interested in iodine supplementation specifically for breast health, they want to take a certain form of iodine that is iodine, you know, rather than iodide. Same with when you're trying to protect yourself from radiation. It seems like iodine might be the better one to take. Now, what dose is needed? Again, I'm not giving medical advice. I'm just giving you information on one doctor's remedy for iodine that will also handle if you happen to have excess bromide or fluoride in your system. And it's basically taking sea salt, which also has several other minerals, for instance, chloride and other trace minerals in it, dissolve it in water, and drink that and follow it by a large amount of water, and then repeat it until you're urinating. And unprocessed sea salt is preferred because it still has all the minerals in it. So this is in addition to taking iodine. I'll get to another slide that shows more specifically what dose of iodine people is recommended. But before you get on to dose, you really need to have your iodine sufficiency tested. Now, doing a blood test for what your iodine is doesn't really tell you much. But doing a urine test tells you a lot, and that's because the method is to take an iodine tablet that has a known specific amount of iodine in it, and then start collecting your urine over the course of 24 hours. How much of that iodine you took by mouth ends up showing up in the urine sample tells you how sufficient you are. If you really, really need iodine, your body's going to hold on to a lot of that tablet. If you have plenty of iodine, your body will throw off most of that tablet. So the number that's been agreed upon is 95%. If you've got, 90% or better. If you take this tablet and you are excreting 90% or more of it in the course of urinating for 24 hours, then you have sufficient iodine in your body. If you take this tablet and you are excreting less than 90%, you have some degree or other of iodine insufficiency. So for instance, your number may be 43%. That means you excreted only 43% of the tablet. So you are deficient. The last 3 people I got iodine sufficiency tests on, two of them, their numbers were in the 70s and one in the 80s. Not bad, but still showing an iodine deficiency. You can probably find more labs that will do iodine sufficiency tests. These are just a few that have a lot of experience with it. Now, back to what sort of supplements you need. Old-timey iodine remedies that have been given for more than 100 years is called Lugol's solution, named after a French physician who first mixed it up. And this is 5% iodine, elemental iodine, 10% iodide, that's iodine as a salt, usually with potassium, and then the rest of it's water, distilled water. Now, the same solution in tablet form is double strength. So 1 tablet equals 2 drops of the solution. The form that's usually given out by governments after radiation poisoning or radiation spill is SSKI. K stands for potassium. This is the potassium iodide salt. So there's several different ways to take this, but how much you need has to do with your specific test results and what you're trying to handle, what the relationship is to your iodine sufficiency. Aside from iodine sufficiency being tested in the urine, the same labs will often offer bromide and fluoride urine tests to see if that's the reason that your thyroid supplementation and iodine supplementation isn't quite working. And to overcome excess bromide or fluoride, aside from ferreting out the sources of these toxins and getting away from those things, which could be medicine, it could be your water in the case of fluoride, it could be toxins in the environment in the case of fluoride or bromide. You want to not only take iodine supplementation in pretty high amounts in order to just overcome, just saturate, just overpopulate compared to bromide or fluoride, but you also want to take the salt remedy, Dr. Chevin's remedy, or it's not the only one out there, it's just a suggestion of how to get concentrated salt. You have to provide chloride. It's in salts. Of course, salt is sodium chloride. You have to provide plenty of chloride and plenty of iodine to bump this bromide and fluoride off of the sites that should be occupied by iodine. But as I say in this picture here, biochemical individuality is the key. What you need and what's correct for you is different from what's needed by the other guy, by the next person. And for a lot of people, whether they're youngsters or elderly, iodine supplementation can be the key to recovering energy when they're doing, quote, everything correctly medically and they're still not feeling great. This could be the thing that makes a big difference. It is possible to feel good again, and unfortunately, so much of our aging population just gets told, well, you're getting older. And there's this whole, quote, anti-aging movement that's taking hold in the country, but I like to look at it as pro-aging. Yes, you're getting older. You can still be healthy and energetic as an elderly person, and often iodine and thyroid really holds the key. Of course, for younger people, you could just optimize your performance, whether you're an athlete or a single mom, or going to school and trying to hold down 2 jobs. Again, going to somebody who really knows what they're doing with interpreting the thyroid tests and who is, willing to do iodine, bromide, and fluoride tests, you could really, find out exactly what you need in terms of these supplementations instead of just going cookbook. So again, more examples of things that your doctor might not know or may not be telling you. And just my little disclaimer that you have to go to really your own doctor, but this is one of those areas that I think it's quite treacherous to just go to the health food store and go shopping and say, I heard these great things about iodine. I really think it's something that you need a informed physician who's willing to be a bit of a detective, who knows how to interpret the tests and knows what other factors may be playing in when everything seems to be he's doing all the right things and the person in front of him is still not getting better. There's more to be known. And I also have to just say here, a lot of times with thyroid, if the thyroid's out of whack, it's quite possible that in the very same person, the sex hormones are also out of whack, which have remarkably similar list of symptoms. So you really cannot treat any particular gland as if it's just sitting there out on an island by itself. And in some people, you just really need to look at the whole hormone picture. So are there any questions?
Absolutely. There have been lots of questions coming in during the presentation. But all the same, I'm still going to mention to folks, if you're new here, just remember there's a blue panel on the right side of the screen, and you can type in the question box whatever questions you have, and then we shall, Sherry and I will begin to ask them after this quick, brief interlude. And Moira, if you don't mind, I'm just going to take this from you momentarily,
Sure.
and then just keep that slide up because I'm going to hand it back to you very soon. Oops.
Okay.
Hang on just a minute. Okay, there you go. Oh. All right, folks, thank you for joining us. Just remember, these recordings, we always get people asking questions about, can I listen to it again? Can I watch it again? Unfortunately, or fortunately, we only make the live presentations free of charge. So if you join us on the phone or by computer, you can watch these presentations free. Now, if you would like to get a recording afterwards, they shall be available in the store probably this weekend or tonight's presentation. We do offer a membership feature whereby you can, I think it's still $15 now, but we mentioned at the beginning that at the end of the month, beginning in March, we're going to increase it by probably another $10 at the very least per month. So if you want to take advantage of this feature, the next two weeks would be a good time to do so. What it simply means is that you have access, you can download and keep all the webinars that we have released in the last 30 days. And not just that, you can also keep the MP3s, and you can also have the handouts, not the slides, but the handouts of the slides. You can keep all that. I think that's a pretty good deal. I mean, the only way it would be a better deal would be if we paid you to take advantage of it. So be sure to take a look at it at the store, and if you have any questions, just contact us back. All right, let me hand it over back to Moira, and then we shall get going with the questions. Sherry, you want to start tackling some of those questions?
Okay, certainly. Okay, the first question, is it possible that iodine deficiency has caused the increase in thyroid cancer?
Absolutely. There's just no question. Absolutely, for two reasons. One, the thyroid gland is just not operating correctly, and it has a lot to do with correct programmed cell death, as I mentioned, in all sorts of tissues. But also, it makes the thyroid gland more vulnerable to radiation, whether that radiation is from living near a power plant or the radiation we've got in the air, or medical radiation, or cell phone radiation. So I don't think there's any question that it's possible.
Okay. When somebody has their thyroid removed, the question is, what do they do, and is there any recommendation on how to deal with, it says, with that issue, but recommendations?
Well, when somebody's had their thyroid removed, they either had a toxic goiter, or they had severe autoimmune disease that was so out of control that it was threatening them metabolically. I mean, you can even have a heart attack from an out of control thyroid, or it was cancerous. Now, oftentimes they will not remove the entire thyroid gland. They'll do what's called a subtotal thyroidectomy and leave a little snippet of thyroid in there. And again, I would use blood tests to follow it and to determine, what's really needed there. But because there's so many things that can interrupt the conversion of T4 to T3 at the tissue level, and the utilization of the tissues of taking that extra iodine off the T4, then in those people too there may be a role for iodine. Again, I'd go with the iodine sufficiency test, and I'd go with what's happening with the whole person, and there's no rote answer for everybody, but there's just, being very, very individual.
Okay. What are the optimal levels for the TSH, the T3, and the T4?
There's wide ranges. It varies by lab as to what the range is, but most people would want you to the right of the middle if you're a functional medicine doctor. So just being in the middle or somewhere in that range is not enough. We'd want you on the high end of normal.
Okay. How much iodine do you recommend for a healthy person, and how much iodine for a person wanting to detox from?
Again, you cannot make recommendations of this, so it really should be followed with an iodine sufficiency test. And the person should be followed according to, how well they respond.
Okay. What is the dough conditioner that you mentioned that has iodine?
I didn't get your question.
What is the dough conditioner that you mentioned that has iodine in it?
It has bromide in it, which is, but they're now switching over to an iodine-containing dough conditioner in Australia. I don't know the name of it. But in these dough conditioners, iodine is exchangeable with bromide, so apparently it's some sort of easy concoction to make up. I don't know the name of it. I think it's generic.
Is the government cracking down on this? Because this sounds really sinister.
Well, the government in our country has not even recognized bromide as a toxin, barely. I mean, the EPA does, as an it's recognized as an industrial toxin, but in terms of, a toxin in small amounts, the fact is it has no known utilization in the body and has only toxic effects. But of course they allow it to be in cleaners, they allow it to be in hot tubs and some pools. If people don't want to use chloride, they're allowed to use bromide. So the EPA does have a tolerable limit below which it's not supposed to be related to health effects. But when you look at, low-level health effects that don't get recognized by the EPA, there's tons of examples of that. And then we look at a whole country like Australia going, let's get this bromide out of our bread and put iodine in it instead.
And the fact that it's in everything from, you mentioned Gatorade, right?
Yeah, drinks that have fruit flavoring, it acts as a stabilizer of the fruit flavoring. I know when I go to the gym and I see people chugging on, these sport drinks, I just want to go up to them and say, no, please don't do that.
So it's not just high fructose corn syrup we have to be worried about.
Oh, right, as if that isn't bad enough. And now we find out that the high fructose corn syrup processing mechanism actually leaves traces of mercury in the darn stuff.
Great.
Okay, here's another question. It says, I believe Graves' disease is an autoimmune problem related to the thyroid, but does it have anything to do with iodine? Excuse me, I'm sorry.
Yeah.
But does it have anything to do with iodine? If not, what is it?
Well, the thing is there's several different autoimmune syndromes that end up as thyroid, and by autoimmune we mean for some reason the body is making antibodies against its own tissues. And the theory is that once you have an autoimmune disorder, you're sort of stuck with it because we don't have really specific treatment of the cause there because we don't know the cause. And that all you're left with is, sorry, you're going to have to take thyroid forever after. But actual practical experience has shown that even people with autoimmune disorders of the thyroid can benefit from a variety of supportive treatments that don't necessarily involve thyroid hormone. I mean, I know one person who had Hashimoto's thyroiditis, another autoimmune disorder, and was able to come off her thyroid supplementation just by supporting the adrenal gland with herbs. The adrenal being sort of in some systems, it's looked at as a gland that's superior to the thyroid. So once you straighten out the adrenals, the thyroid gets its act together. And it's been 20 years and she hasn't had to go back on thyroid hormone. So the conventional wisdom is if you have autoimmune disease, it's just an antibody problem. It doesn't have to do with nutrients or toxins or anything. The fact is we don't know what it's due to. And again, I would use the labs to guide the treatment. And if you have an iodine insufficiency as shown by the test, then it seems like it would be reasonable to supply iodine. And for all we know, autoimmunity is a reaction to toxins in the environment. So in that type of individual, I would definitely encourage urine testing for body burden, fluoride, and bromide as well.
Okay. Would this ingesting iodine before radiation to treat cancer be something that we should be aware of?
Well, that's a really good question. I was afraid it would come up. I would really love to talk to a radiation oncologist who doesn't have a knee-jerk reaction to this and can really think with it, rather than giving some kind of everybody knows type answer like conventional wisdom where they really haven't observed the problem. Because the idea of iodine is to attack, radioactive, radiation for treatment is to attack the cancerous tissues. That's why radioactive iodine is a treatment for thyroid cancer. It goes right to the thyroid gland, it's avidly taken up, and it causes destruction of thyroid tissue. But for just regular radiation that you're getting, again, iodine is concentrated by the breast tissue. So if what you're treating is breast cancer, well, it seems to me you want to let that radiation work without iodine. You know what I mean? But I've got a real simplistic view of it. I don't know the answer to that question. If it's the iodine is directed toward a cancer that's in an area of the body that's not known to be something that's avidly taken up iodine, it seems like it would be prudent to take iodine supplementation. Again, not giving medical advice here, but it seems like it would make sense.
Okay. Here's a question that's actually by our dear friend Dr. Steve Sum. He's a chiropractor in Colorado. And it says, I heard that women with fibrocystic breast disease with iodine deficiency will notice a softening of the knots in these breasts. What is your experience with this precancerous condition? And then it says, thanks for the great webinar and valuable information for all of us in the wellness industry.
Well, great, Doctor, and I look forward to your upcoming webinar. That's right. Is this the one who's going to be doing a webinar next?
Yes.
Right? Okay, yes. Good. I look forward to it. Well, yes, the clinical experience is that if you're iodine deficient with fibrocystic disease, that supplying iodine will diminish or eradicate that condition. Now, the other situation is the women who have lumpy, bumpy breasts tend to get more mammograms because, oh, here's another lump, here's another lump, and they're running and getting mammograms, so they're actually getting more radiation exposure. And lo and behold, have an increased risk of breast cancer, even though fibrocystic tissue itself hasn't been proven to convert over into, breast cancer. You just wonder if it isn't because these people are more in the medical system and getting irradiated more. There's differences of opinion on that one. But since we know that iodine is taken up by breast tissue, it does make sense that it would work that way. And that might not be the only factor in particular women. Like I said, they may have sex hormone imbalances or other factors. There may be something going on with the food that they're eating, So there's other nutrients that can affect fibrocystic disease. But it may be a factor, definitely.
Hey, Doc, there are so many questions coming in, and I was wondering maybe it might be a good idea for you to actually take a look at them and kind of scan through yourself and see what stands out. You can just the questions you want to tackle, just read them out yourself. And
okay, I'm sorry. Where are they on my little?
I'm getting on it.
Okay.
I need to.
I figured this would be a popular topic, and again, I could spend several hours, and I hope that I gave somewhat of an overview without overwhelming. It's quite a delicate.
Right there.
Moira, are you there?
Yes, I am.
Okay. You should see another panel now called attendees. And so you would
Yes.
that one now, and then there should also be another panel that comes up that you can see that says questions.
Yes, I've got it, yeah.
Okay.
Yeah. Okay. I wonder how I expand that. I can't read the whole question, unfortunately.
Oh, just go to the corners, and then an arrow should come up, and they can just pull it, expand the whole thing, whichever way.
Oh, there it is. Okay, I got it. Yeah.
When you can actually click on the little pop-out box. And
Okay, there's a question here. Yeah, I've read that too much iodine can cause inflammation of the thyroid. How much is too much? Again, it's very individual, and it's best, as with any supplement, to start off slow and to see how the person reacts. There are a certain small percentage of people that will get thyroiditis, which is inflammation of the thyroid gland, when you first start iodine supplementation. And this is another reason why iodine supplementation should not be undertaken willy-nilly or just going to your health food store and getting some. In fact, iodine can only be given in certain amounts over the counter, because believe it or not, it's one of the steps, one of the ingredients that's needed in illegal meth labs, methamphetamine labs. And so the Drug Enforcement Administration limits how much iodine a pharmacy can actually give out. But anyway, it's still possible to go and get over-the-counter iodine just from having read something on the internet or having listened to this webinar and going and all of a sudden getting an inflamed, tender, sore thyroid gland, which is why I think it should be done under the guidance of a practitioner, because at that point it might be necessary to back off, to start slower, but in any case it should, even starting it, should be guided by iodine sufficiency test. It doesn't mean that the person cannot take iodine. It means it should be done on a lower gradient. Somebody asked, what's the effect of bromide on puberty? It can actually prevent sexual differentiation, so it can really interrupt puberty altogether. Let's see some of the other questions. Should someone taking thyroid medicine take supplemental iodine above light iodized salt? Again, I would use the test to guide you, but I would say the likelihood of people whose thyroids are so deranged as to need to take supplemental thyroid hormone would not be surprised that they are profoundly iodine deficient. So I would not do it empirically. Do I recommend dining at a Japanese restaurant often for recommended seaweed? That can get kind of expensive. You can go to any Asian market and get, the dried seaweed, and as long as it's high quality and not coming along with a lot of sea toxins, I would use it liberally in your cooking. Do I recommend an endocrinologist if a person's on thyroid supplementation? Some people feel more comfortable going to a hormone specialist that's an endocrinologist for their initial visit, but most internal medicine doctors and a great deal of family doctors feel quite comfortable with maintaining somebody on an established dose of thyroid hormone once that's discovered. Some gynecologists actually are, because they're dealing with all the hormones, are seeing a lot of the same population, and they're the ones who end up doing the thyroid test and getting the person on thyroid supplements. So it does not necessarily have to be an endocrinologist. We have a real disadvantage in this country in that endocrinologists are some of the worst in terms of giving advice from 50 years ago regarding diabetes and thyroid, and are some of the least likely to be willing to be scientists about it and actually look at the current literature on iodine, thyroid, not to mention insulin, leptins, and other things that affect thyroid and diabetes. So sometimes by going to a super specialist, you have given yourself someone who's so orthodox as to prevent observation. I mean, it was said by Roger Williams, the great functional medicine physician from here in Texas, who wrote the first real book for the public on vitamin supplementation back in the 70s, that science stops when orthodoxy starts. So when you hear orthodox or conventional, they're just sort of going on authority rather than their own ability to observe and look and read the literature and find out what would be best. Let's see. I knew this question would come up. Is painting iodine on your skin useful for determining sufficiency? Yes, it's useful. It is a qualitative test as opposed to a quantitative test, meaning you can get an idea if your iodine is insufficient, but you can't tell to what degree. Whereas the urine test gives you a number that can be followed and compared down the road. So if I have a patient that gets an iodine sufficiency test today and it's reading at 43%, and I give them a dose of iodine for 3 months, I check them the iodine sufficiency urine test again in 3 months, and then the number's up to 85%, I know we've made progress. Now some claim that, well, you can just as well paint the iodine on your skin and see how fast it goes away. But the iodine preparations that you can get over the counter are all different concentrations, and depending on where you paint it on and what lotions or oils you already have on your skin, depending on what's going on with your metabolism on that day, you could have a very different test 3 months down the road that doesn't necessarily have to do with your iodine sufficiency, you see. So I know that it's definitely a useful test, but it's not quantitative, it's only qualitative. Yes, we have a comment here that testing should be done for thyroid antibody tests. And this is, I didn't get into it because I thought it would be sort of too much technical science for our audience, but if a person has never had it done before and they are discovered to have a thyroid problem, they should get thyroid antibody tests. And to discover, whether it's Graves', Hashimoto's, or neither of those, not in the autoimmune category at all, and can sometimes help the doctor know what to expect with the course of the treatment, of how it's going to go, whether this person's going to be on thyroid hormone forever after, or whether there's going to be some other factor. Would iodine help fertility? If iodine is related to a thyroid problem, yes, we expect it to help fertility. But as I said at the beginning, iodine is also concentrated by the ovaries. What it's doing there, we know in animal studies that it does affect reproductive health. The studies in humans are less robust. There's so many factors that go into human fertility that it has not yet been identified as a single determining factor as to whether somebody's fertile, but certainly it is part of an infertility workup to check the thyroid. Like I said, a lot of doctors just stop there, and they don't take the extra step of checking the iodine. So if you've already gone the route of fertility testing and you've gone the route of thyroid testing and nothing really has shown up, you might want to take that extra step of iodine testing In the bigger scheme of things, an iodine test costs anywhere between $70 to $100. It's sure cheaper than some of the other aggressive treatments you're going to get for fertility if it's shown to be out and just simply needs to be replaced. Where can I get a book on this to read myself and to share with my doctor? Iodine, Why You Need It, Why You Can't Live Without It, by Dr. David Brownstein. Can be obtained on the internet for 10 or 12 bucks. There's many other iodine books. In the one slide I had on the iodine labs, all those iodine labs have literature references. There are an increasing number of books out on this topic. There's one really good one called Stop the Thyroid Madness. That's by Janie Bowthorpe, B-O-W-T-H-O-R-P-E. Let's see. What other good thyroid books do I have? Anyway, those are a good start and have a lot of references to other books within those. If you go to the website for Hakala Research Labs, HAKALA.com, you can find some references there. If you go to FFP Labs, you can find references there. I mean, once you start looking, you'll find a lot of references. Let's see here. And it would be really good to educate your physician. Okay, is taking soy products harmful with a low thyroid condition? This is a really good question. Oh, I'm really sorry about my dog. This is a good question, and it's an area that I'm currently investigating. If it's not organic fermented soy, it's very possible it can interfere with your thyroid function and your thyroid's use of iodine. So as if you needed another reason to eat organic. But for a lot of reasons, soy products that aren't organic and fermented, in other words, unfermented soy products, can be hormone disruptors, including thyroid. Suggestions for finding local doc familiar with this info. Completely out of advice for you on that one, I'm sorry. Then there's a request to please show Dr. Shevin again. I had a slide that showed Dr. Shevin's remedy. You could just go to drshevin.com, I believe it is. Let me look it up in my notes here. And you can get much more information than I have put there. And I just put his up as just an example of what one doctor is recommending in order to overcome the toxic halides. Let's see here. Dr. William Shevin is his name, yes. Dr. Shevin, DrShevin.com. And you can find a lot of information there as well as some additional book resources. Someone wrote a comment that iodine supplementation can actually worsen conditions. They seem to be related especially to autoimmune conditions. And again, this is where you need somebody who's experienced in the thyroid gland, seeing exactly what the person's problem is. If it's not iodine insufficiency and they are making antibodies to their thyroid gland, another reason why you should not just go over the counter and start taking iodine. And another reason why it would be best to do this in conjunction with the doctor who knows what they're doing. So there's another request for the salt remedy. Actually, I was really giving Dr. Shevin's formula there as an example. I don't want to be giving, medical advice, and I refer you to Dr. Shevin's website for more information on that. Let's see. Have I heard of painting iodine on the front of the neck over the thyroid area for absorption via the skin is beneficial? No, I have not. Doesn't mean it's not happening, but I have not heard of that. Another person says they've been taking synthetic thyroid supplements for many years and would like to go natural. Oftentimes that is not possible. But certainly iodine sufficiency should be looked at. Sometimes it can decrease the thyroid hormone dose, and rarely a person can come completely off. And other times there's other hormone issues that are keeping the thyroid from working optimally. Is sea salt a good source of iodine? Yes, unrefined sea salt, but it's extremely variable. In fact, it can be variable batch to batch, so you're not sure how much iodine you're actually getting. Someone asked about desiccated thyroid. Is it really a natural thyroid supplement? Well, it comes from pigs, so I don't know if you want to call that natural. And Armour Thyroid is no longer available as of about a year ago, unless the pharmacy still had some on stock. But the company stopped making it. Because they got word that the FDA was getting ready to put the hammer down on it, just like they did with estradiol. And they're anticipating that the FDA is about to say that you have to submit a new drug application. Because, see, Armour Thyroid got in under the grandfather clause. It's being used for more than 100 years, even before the FDA was even formed, much less when the FDA started certifying drugs. The FDA was formed in 1938, and they started to approve or disapprove drugs in about 1963 with the Kefauver Commission. And drugs that had already been in use for a certain number of years at that time just got so-called grandfathered in. And Armour Thyroid was one of those. So it's never had to go through the testing and what's called a new drug application process through the FDA. And because of what they did with one of the bioidentical estrogen hormones and some, there was some talk that the same thing was going to happen to Armour Thyroid, and the company did not want to get stuck with a bunch of backstock that it couldn't sell. The company actually won't talk to you about it. I've tried to call them. But this is what we're supposing happened. So anybody who was on Armour is now finding it extremely difficult to get unless they happen to run into a pharmacy that had some still on stock, but the company's not making it anymore. Is it really natural? It comes from pigs. No, it's not natural. Whereas synthetic thyroid hormone is an exact test tube made copy of what your body's making, but it's only T4. The advantage of Armour Thyroid, it was a mixture of T3 and T4. And for people who have difficulty of peripheral conversion of T4 over to T3, it was the preferred combination. Now, T3 still is available under the name Cytomel. So your doctor can prescribe that as well as synthetic thyroid hormone and take 2 pills, or can ask a compounding pharmacist to make up pretty much what was Armour Thyroid. But now that Armour Thyroid is no longer available as far as I understand. And there's a question, what is Hashimoto's disease? It's just a condition where you're making one of several conditions where a person is making antibodies to their thyroid gland. Is there a good test for small children? I'm going to have to back off on that one because I am not a pediatrician and it's completely out of my area. I don't know that. Someone else is taking 50 milligrams of iodoral on doctor's orders, can taste it about 5 hours later. It probably has a metallic taste. Would this mean that I'm getting too much? I've been on it for 18 months. My goiter has gone back to normal. I would use iodine sufficiency test to guide an answer to that question. Can iodine deficiency cause skin allergies due to environmental and chemical exposures? I actually do not know the answer to that. Somebody's letting us know that King Arthur's flour has no potassium bromate in it. That's good, so it doesn't have the dough conditioner containing that. Could fluoride in the water supply cause thyroid issues? Absolutely. Fluoride displaces iodine. What about toothpaste? Absolutely. That's why fluoride toothpaste has on a warning that it should not be swallowed and should be kept out of the reach of small children. Would a person with Hashimoto's be able to get medical counsel to guide from traditional chemical hormone replacement to herbal alternatives in the example I gave? Let me just say that individual's situation where they had Hashimoto's and got off a thyroid supplement with herbal treatment of the adrenal gland is unusual. It is not usual. it turns out on that particular person, probably the Hashimoto's was a minor condition and the adrenal insufficiency was a major condition. That person really continues to be needed to be checked every few years on their thyroid hormone to see if they're still maintaining the state where the Hashimoto's is not damaging their thyroid. So I think that's an unusual example that I brought up. But you have to go to a practitioner who's willing to work with you and as much as possible use objective laboratory tests to guide what you're doing so they don't inadvertently direct you into getting off your medications and then you becoming profoundly hypothyroid by accident. Somebody writes in and tells us that clothes which are manufactured offshore are usually treated with solutions which repel insects and parasites. Would this solution contain toxic materials like bromide? Very likely. Unfortunately, these clothes and so much of our electronic equipment and other materials don't come with an ingredients packet, so we actually don't know. So I would just have to say I imagine it's possible. Someone asks about the iodine skin test. Again, it is a quantitative test. Well, then they say, well, what if you still have some on your skin 24 hours later? Does that mean you're not iodine deficient? That would be an indicator that you're probably not iodine deficient, but I think there's so many things that can affect skin absorption that I personally wouldn't rely on that. Why can't you sprinkle arami, that's a type of seaweed, on food? You absolutely can. We'll make it a little salty. Let's see here. Has anybody studied iodine in sleep apnea? I don't know the answer to that question. Somebody asked for a clarification of Dr. Shevin's name. It's Dr. William Shevin, S-H-E-V like Victor, I-N. drshevin.com, drshevin.com. It's Dr. Shevin. There's a reference to a website, www.thyroid-info.com, where there apparently is a list of doctors who would help you find someone in your area. Well, there's lots of other questions. I think I'm kind of answered out here. I wasn't able to answer them all. It's an area that there's rapid educational resources for physicians as well as patients coming to light that has not been to light before. One of the articles that I quoted was just published this year, as a matter of fact. So you know, there's still lots to learn. The main thing is that you really cannot cookie cutter this in medicine. You have to look at the person who's in front of you. Mm-hmm. Mm-hmm. And you really have to deal with that quite individually. If somebody's interested in doing a home skin iodine test and going to the store and getting their own iodine supplementation and working with that for a few months, and then they don't get optimal results, at that point they might show up at the doctor's office and say, okay, I did this, this, and that, now I'm ready for the iodine urine test to see where I'm at. You know, so as long as they're not doing something that's going to give them thyroiditis, there's probably a lot of people out there trying to doctor themselves just for lack of an informed doctor to go to.
Right, right. Well, this has been great, as always, with Dr. Dolan. Thank you again. And a few thank yous here. The last entry said, thank you so much for this informative presentation. Excellent. Which pretty much sums it up.
Well, you're very welcome. And again, if you have me on regarding this in another year, I might have a whole bunch of new information. So we'll see how it goes.
Let's see how it goes. Let's see how it goes. We are going to be talking about biochemical individuality sometime along the way, aren't we?
Yes, that's right. I did promise you another webinar on biochemical individuality, didn't I?
You sure did.
And this is just an example of it. You know, it's like you've really got to treat the whole person. Like I said, sometimes there's problems with progesterone, estrogen, testosterone. There's other things, and again, with iodine being taken up by all the hormone, sex hormone sensitive glands, it's no wonder that you might have to handle multiple hormone derangements all at once in one person, and it can be quite a balancing act. And when it comes to hormones, it's not that iodine is good or bad for you. It's not that somebody needs or doesn't need thyroid. It has to do with balance. And that is when we come down to definite biochemical individuality.
Right. And I know your questioned out, or your answered out. The question that was looking in my mind during the presentation was this: is iodine deficiency, is that almost equivalent to thyroid under activity, low thyroid function, which is
well, when you're severely iodine deficient, you're definitely going to be low thyroid. But people can have a certain degrees of iodine deficiency, lesser degrees, without the thyroid hormone test being frankly abnormal. They may be in the low normal range.
Okay.
But on the extreme end, absolutely. If you are severely deficient in iodine, you just simply cannot make thyroid hormone because it requires 4 iodine molecules.
Right. I understand in the United States especially, there are a lot of low thyroid function people walking around.
Yes, they are. But they still fall within what's considered the normal range, that they're walking around with all the symptoms.
Got it. All right. Well, this has been great. Thanks again, Dr. Dolan, and we'll be looking forward to having you on sometime in the near future.
My pleasure.
All right. Well, folks, you have a great night. It's been great. If you have any more questions, just shoot us an email. Hope you guys have a wonderful weekend, and God bless.